two folks in the room, Renee and Dana. And just so you know you're in the right place, this is the Breakout Room C, Gender, Sexuality, and Reproductive Health with Dr. Lisa Cohen and Dr. Maria Masolo. And I will turn it over to you both to lead us further.
Sure. So welcome. I am Maria Masolo, and I'm the co-lead of this node with Dr. Lisa Cohen. We're both at Kaiser Permanente Division of Research, where Lisa is the director of the Autism Research Program, and I'm a senior manager there and qualitative researcher. So what I will do now is provide a very brief introduction, because as Dawn said, the goal of this is to have a conversation with people joining this breakout. So I'll talk a little bit about the node's goals and priority areas, and we'll mention a couple of studies we're doing and other areas we're working on. So our guiding principle is that sexuality and relationships contribute to life satisfaction and well-being for everybody, and this includes individuals with autism, autistic individuals. And our goal, our overall goal, is to improve sexual and reproductive health and healthcare for autistic individuals in these areas, with the focus on, the special focus is on women's reproductive health and sexual and gender minorities, or LGBTQ+ individuals, autistic individuals. So we have identified some preliminary priorities. We're still exploring this area, and those are sexuality education, sexual and reproductive health services, sexual victimization and abuse, and sexual and gender minority health, or LGBTQ+ health. Again, as I said, these priorities are preliminary, but we're still working on establishing research priorities within the node. How do we work in this node? We work with a stakeholder advisory group, and that is 6 autistic individuals who are experts on these areas and also who have lived experience in these areas. And they participate at all levels of our activities, our node activities. I think that our work is guided primarily by this notion of co-production of knowledge. We're working with autistic individuals. We're not working on behalf of autistic individuals. I think that that's in general a goal of AIR-P and definitely the goal of our node. So we have been embarked on identification of urgent knowledge gaps, and this field is relatively new in the sense of, or this area of knowledge and expertise is relatively new in the sense that I think that with developments in the disability community and autistic individuals organizing themselves and participating in the field, there is this discovery that all of a sudden autistic individuals, disabled individuals, are sexual beings, which is something that seemed to have been ignored for a long time. So there is a wealth of research in this area that is relatively new. And one of the ways in which we're trying to identify urgent knowledge gaps is through literature searches, as well as joining forces with existing groups and research teams and coming together with a better idea of what the landscape is all about. Our ultimate goal is to develop a workforce of clinicians, researchers who are more knowledgeable and aware of some of the important issues in this field, this area of knowledge. So in this first year, that's what we have done. We have been trying to understand the landscape, to understand the lay of the land. And we have done that through an extensive literature review that we're conducting as we speak. And also, as I said, by joining forces and joining networks, existing networks, and creating further collaborations. We also have a couple of research studies that are going on. One is conducted by Dr. Jennifer Ames here at Kaiser Permanente, and that is a study to address reproductive health and obstetrics, gynecology, healthcare in autistic adults. And the other one is conducted by Dr. Laura Holmes, but it's also focused on the Kaiser Permanente Northern California population. And it's on health equity promotion for sexual and gender minorities, LGBTQ individuals. Lisa, I don't know if you want to say a word about the studies or anything else about the node.
Yeah, thanks, Maria. Just a few comments about those two current studies. Both are pretty much descriptive epidemiologic approach studies, and we're using the very large patient population, member population of Kaiser Permanente Northern California to conduct these studies, looking at electronic medical records for the large autistic population we have in our membership, and looking at both health status and healthcare utilization. The first project focusing on women and persons seeking OBGYN services, just trying to understand what that looks like in the autistic membership compared to a non-autistic, and actually another group of adults with developmental disabilities but not autism. So we have some nice comparisons. And the second project, again, is looking at very similarly looking at health status and healthcare utilization within the Kaiser Permanente system. And this group we're looking at is, as Maria said, sexual and gender minorities, or LGBTQ plus individuals, and comparing to cisgender heterosexual individuals who are on the autistic spectrum. So we've got very large numbers in our system, which is a nice thing to do these sort of population-based public health oriented epidemiologic studies. So we can identify, number one, what's going on, and then number two, then we get to addressing these disparities, which we know are there, and designing in future studies and with other collaborators, interventions to test to overcome these disparities. So we're really excited to be part of the AIR-P and be able to focus on this area, which is a relatively new area, new area for both Maria and myself, but we've got longstanding research and personal interest in autism across the lifespan. So it's a real pleasure to be doing this work. So I think that's all we wanted to say, and we've got such a small group. Maybe those, Renee and Dana and Harpur, we can all introduce yourselves, and then we can talk about whatever you'd like to talk about.
Sure. So hello, everyone. I'm Dana Mason. I'm actually one of the project officers for the AIR-P Research Network. So very excited about this, but I'll let the other person introduce themselves, and I have just a couple of questions.
Okay.
I'm Renee Jameson, and I'm at the University of Kansas Medical Center, and my interest is around girls and women with with autism and other developmental disabilities, and the work that I do, I have started with like a girls program, an intervention program, but then like kind of resulted in this interest in girls and autism, and oh gosh, there's not as many of them, and God, what does all this mean? It means that we don't know that much about them. And then within, so then of course within that line of work, I've seen a lot more around, okay, well, within that group of already underrepresented population, we have a high number of individuals who then are more likely to be transgender, and so that comes around as like an area of interest, or just sexuality and relationships in general. And so I think this that whole piece is something that has grown along the years of just working with this population. And as our LIND kind of program and thinking about building capacity, something that I've been interested in and that we've been trying to do is, okay, well, thinking about the capacity of who do our girls interact with? All right, well, it's the physicians, like the GYN providers. So we've been trying to think, well, how can we increase the capacity for other providers who then can be successful in adapting to the needs that these girls and women and individuals would need to address over time. And so I am very interested in just, any and all of this work around increasing representation and understanding and supports in this area.
That's great. Renee, what's your domain?
Background.
Your background?
Discipline. Yeah, so I'm a psychologist.
Uh-huh.
And I'm our LIND director. And then you were mentioning about the study with the medical records. One of the postdoc fellows that was with me, I think 2 years ago now, we did go into our record, like our EMR or Heron, or system to look at, it wasn't just girls, it was just individuals with autism or other developmental disabilities. And then, looking at, well, did they have, our medical record had the capacity, and only recently started like putting gender as a descriptor, right, as opposed to sex at birth, but to look at other people in our health system who, had expressed gender or sexuality differences, and then like the services they were encountering. So it sounds like similar. And so I think the postdoc presented on it. I can't remember now, like whether it's AUCD or INFAR, but it's, I think we met some barriers obtaining that data because people weren't always collecting it.
Yeah, there's a SOGI questionnaire now in our Kaiser records, but it's fairly new. I mean, I don't know how many, maybe a dozen years, but it's not, it's not a routine questionnaire that patients are asked. So only, I think it's a probably severely under ascertained,
sure.
Sexual orientation, gender identity. Yeah, so we're beginning to sort out how to actually identify these patients to include in Laura's study. And there's been some work, that with the Healthcare Research Network or whatever it's called, that Kaiser's part of, lots of different health systems are part of. And they've published some papers on algorithms they've developed to, find in the EPIC record or the EMR individuals that meet these definitions. But yeah, and I think that's one, that in itself would be a great outcome, is to encourage as a system change, as an intervention, is to get this kind of question. I'm not sure if it should be routinely collected like other vital signs, but maybe so, because we know that it's so related to health outcomes and health status and access to services, even when you have health insurance, in a system like Kaiser. So
for sure, that's like even thinking about like then the age range, because that was a piece that came up in our institution, like at what age, who you're going to ask, the caregiver versus the individual. But we do have so we're part of so KU Medical Center is where I'm at, and then we're on the Kansas and Missouri borders, and Children's Mercy Health Hospital. And actually, we're merged with them, but it's kind of confusing anyway. They have a clinic where they're doing like gender reassignment and transgender clinic for kids, and then we have an adult component. But this is and we've been talking about doing screenings in kind of both places, like in our autism clinic and then in that clinic. But it's just again slow to get off the ground. But I think there's, like you said, an outcome even just to be able to understand some of these needs and kind of like what's going on. It's capturing the people that we're probably missing.
Yeah, it's really exciting work. Does your postdoc have, the person who did that study, do they have a publication or even a poster presentation that?
Yeah, I'm pretty sure it was a poster. I have to look. She's in St. Louis now. Like that's where I think she's at SLU. And I'll look. I'm pretty sure, I can't remember if it was just AUCD. I think it was AUCD because she came back. So there was the postdoc fellow and then a social work master's student. And they did a joint project for our LIN program. And then the next year came back and presented at AUCD, like the year after they were completed.
Well, it'd be great to, I'm sure Jen Ames, who's leading that project, and then Laura, both of them are very interested in seeing the if they could be
and I can share that too. And I know, and I will ask her, like what if she's doing anything now. I know she was interested, but it's kind of one of those things. Well, then she went for postdoc fellowship to like got her job and kind of got her. But I know that from a clinical perspective, that was an interest area for her as well. But yeah, I will message to you guys kind of what we have as well.
Great.
There, and I think I wanted to, so Laura Holmes's project number 2 there is a scholars, was funded by the Scholars Program. And there's another project that was funded by the Scholars Program that Maria, you're starting to work with that new investigator on. And that can you just say a word about what the focus of that?
Yeah, it's on mental health for LGBTQ individuals, autistic individuals.
And are they transition age though, that project?
They are adults.
Adults, okay.
Yes. And it's also a community-based participatory research, and it's just getting off the ground, but very exciting. Yeah.
And where at, did you say?
UCLA. Well, the person is at UCLA, is a doctoral student. They're going to be working with they're recruiting from different community organizations, and they're going to be talking with our advisory group and all that to recruit participants.
But local, more so.
Not necessarily, because I think that all the work, in this day and age, all the work will be done online or chat groups or whatnot. So I think that, if you have any suggestions or any groups that you think might be good, or individuals who may be good for this kind of work, shoot me an email and I'll be happy to put you in touch.
Well, yeah, I'm just thinking from a recruitment perspective, because we could send it out to our listserv. We have, 230, I guess, girls or more, like in our network, girls and young women, because we have the girls who are women who are they're almost 30, now. And so we definitely have people that I think might be interested or that could potentially qualify. So yeah, I'd be happy to share it.
Okay, that'll be great. But I want to make sure that Harper, you introduce yourself and.
Oh, I'm Harper Schwartz, thank you, with AUCD. I'm just here for support, but I believe we're going to be pulled back into the main session in just 50-ish or so seconds. So I just want to make sure you all have any final comments or questions.
Yeah, Dana, did you have, you said you might have some questions, or if we run out of room?
No, I can follow up. Like I said, I just a quick note. I just really love what Dr. Quo's doing and how she's intentional with including autistic researchers on their autistic researcher review board to help with, appropriate terminology. I really think it strengthens all the work and thinking through what AIR-P is doing. So just wanted to just throw that out there. But I know, Maria, you had mentioned that advisory group. I was just wondering about the representation in terms of gender and sexual identity and all that good stuff, but that's just something to think through. So,
well, we can send you a note in the chat, because it's a very diverse, dynamic autistic group.